Okay, so this is the wound dressing change and irrigation for Taylor Smith. I have had this patient for the morning. His vital signs are stable. He is afebrile and his pain is at a manageable level right now. So knowing that I have this wound care to do, I've left the room to get my supplies and also confirm the order for it and the procedure that I'm going to be doing. So to do that, I will go to the patient Taylor Smith's orders, potentially a wound flow sheet and nursing notes to see how the patient tolerated the dressing change in the past and how exactly it was completed. So I'm just going to quickly show you. This is the right patient, Taylor Smith, and his orders that I'll be reading from. Okay, so I see here that I'm supposed to be changing the dressing daily, irrigating with normal saline, applying skin prep to the surrounding skin, packing the wound with saline-soaked gauze cling, covering with 4x4 gauzes, and an abdominal pad, securing with tape. This was published by a colleague registered nurse of mine, and I can see below that this dressing change has been endorsed and supported by Dr. Urgent. So that's as good as a doctor's order, so that's great. I can go into the room now. So upon entering the room, I always perform hand hygiene and I do a safety check. What I'm checking for is that the bed breaks are on, the bed height is at a safe level, the rails are up, the call belt is within reach, and oxygen and suctioning work in the room. For the purposes of this video, the bed is going to stay as it is. Hello, Mr. Smith. How are you doing?
Good, how are you?
Good. So I've brought all my supplies with me for that dressing change. Are you still feeling up for it right now?
Yep.
Okay, and any change in the amount of pain you're experiencing at the moment?
Nope.
Okay, and do you need to use the bathroom before we do this? It might take a little bit.
Nope.
Okay, good. So at this point in time, I'll do my PPID and allergy test. So Mr. Smith, before we get started, can you please just confirm your full name and your birthday for me?
Taylor Smith, March 7th, 1964.
Okay, great. And Mr. Smith, any allergies that you know of?
Nope.
Okay, no allergies to latex?
Nope. Okay,
great. So I compare his birthday and name to the patient care orders as well as his wristband. Okay, and now I am good to be setting up my sterile field. Before I set up a sterile field on any surface, I will wipe down the space with this. We will assume that I've done that already, and I will do some hand hygiene. Okay, so I'll start by setting up my sterile field. So Mr. Smith, as I get going here, did you have any questions about this procedure that you wanted to ask me?
Nope, I think it's pretty straightforward.
Okay, great. So what I would do right now is just only touch that 1-inch border of my sterile field. I'm also just going to gently move this a little bit. Okay, grab these sterile forceps. Okay, so I can leave those right there for now. Well, actually, this is a sheet of paper that's an extension of the sterile field, and I don't need that for what I'm doing, so I can put that in the garbage. There's a garbage bag that I will use. Mr. Smith, do you mind if I use some of your bed as a working space?
No, not at all.
Okay, great. I should have asked before. I just flew that garbage bag down there. Oops. Okay, so at this point in time, the corner of my hand did just touch the tray, so that would be my first contamination of a sterile field, and I would just get a new dressing change kit. It's so early in the game, that's not a problem. For the purposes of this video, I'm going to continue. Okay, so I've just kind of removed that, and I'm going to start to add things to my sterile field now. And the way I add things is the reverse order that I'll need them. So this is an ABD pad. It's going to be the top layer of my dressing, and this was included in the wound flow, or the wound care orders, rather. Okay, and here my 4x4 is also ordered as part of the dressing for the patient. Okay, now I've got my sterile gauze that I'm going to be packing the wound with. Okay, and I'll just put that over there. the reason that we pack wounds is to absorb any exudate or debris, as well as to promote healing from the bottom up or outside, from the outside of the edges to the inside of the edges. So that's good to know. Okay, so here's my steri strips to secure the tail of the packing. Okay, I'm also going to be getting to cotton Q-tips, one to measure the depth of the wound, and I guess there's just an extra one, just also to palpate gently along the granulation tissue to make sure I don't miss any tunneling or undermining. Okay, then here's my syringe for irrigation, and what I am going to be doing, I'm going to be getting a 30 to 35 cc syringe. This is a 30 cc syringe, and here's my irrigation tip, and that's going to be an 18 to 19 gauge, and the combination of those two will create the right amount of pressure, or PSI, for the gentle, simple debridement from the normal saline, the pressure against it. So now I'm going to get 2 packages of skin prep and add them to the sterile field. And I noticed down in the nursing notes that the nurse was concerned about some of the peri wound skin breakdown, so that was why she ordered this. So yeah, or suggested this, I guess, and the doctor did confirm the order. Okay, finally I'm going to add some sterile scissors to my field. We'll just pretend like they're in a package, and then I'm putting them down here now. Okay, now my final thing that I'm going to do is add normal saline for the irrigation and cleansing of the wound and peri-wound area. So I'm just going to be careful that there's no splash. Also, important to note that as I open the normal saline and all of the packages of the equipment that I'm using, I'm checking that there's no loss of integrity to the packaging, no holes and whatnot, and also just making sure that nothing has expired. Okay, so my sterile field is set up. I'm going to perform hand hygiene. Just going to set up this garbage bag, and then I'm going to remove Mr. Smith's bandages that are on there right now. Okay, so Mr. Smith, I'm just going to put the garbage in between your legs, if that's okay.
Yep.
Okay, great. So this might be a good time for the camera to come to the other side. Okay, so I'm just going to put on some clean gloves for this part of the procedure. Okay, Mr. Smith, so I'm going to start touching your body. Do you mind if I pull down the blankets and pull up your gown?
Nope.
Okay, so Mr. Smith, also at any time, if you experience any pain, just let me know, all right?
Okay.
Okay, now are you comfortable?
Yeah.
Okay, so I'm going to ask you to stay still from this point until the end here, just so that we can keep your wound as clean as possible. Now, I will remove the dressing in a fashion so that it won't be in the patient's line of vision in case that might be upsetting to them. And as I'm removing the dressing, the old dressing, I'm just noting for presence of shadowing or exudate on here. So yeah, that's good. I'm going to take these forceps that helped me set up my sterile field and remove the rest. So there's a little bit of serosanguinous exudate on the 4x4. Let's see what's going on here. Same thing. So I will just make note of that for my charting. And then there is a steri strip that secured this packing. From the nursing notes, I did notice that there is one piece of packing in this wound, so that's what I'm going to be expecting to remove. As we can see, yeah, there's one piece here and nothing else, so that's great. Once again, just noting the character of the exudate on here. I guess I can throw out these tweezers now too. Okay, so how did that feel, Mr. Smith?
Good.
Good, no pain. So if anything was stuck to the granulation tissue or his skin as I was removing this, I could always soak it with normal saline. I'm just going to palpate the peri-wound area specifically for heat, which could be an indication of infection, which there is none. Now I'm going to remove these and I'm going to put on my sterile gloves. How are you doing, Mr. Smith?
Good.
Okay, great. So it's important to note that from really the first time I lay eyes on the wound, actually before I put on these, what I would do is I would take this ruler and measure the length and the width of it, just to verbalize that right now. So I'm assessing the wound at all times. So I tested the temperature of that peri wound space, and yeah, I'll continue to just be assessing different aspects of the wound as I go along. I kind of checked out the wound bed there, but really I won't make any definitive judgments until, okay, so this was not set up or not put back properly, so we'll just pretend like it was, in which case I would be grabbing underneath and then sliding my hands in, but just because I didn't pack it up right, I'm just gonna have to put on my glove in a slightly different way. But that's no problem. Okay, talking a lot here. Okay, so now that my sterile gloves are on, I'm just gonna change a couple things to my sterile field. So I'm gonna just move my scissors, and I'm going to set up my steri strip so that I have easy access to it eventually. Okay, and okay, then yeah, okay, so that's all I'm gonna do for now. Now I'm gonna begin my cleansing by irrigating the wound. So once again, the order called for normal saline, and I've got the right 30 cc syringe and a accompanying irrigation or syringe tip. So what I'm going to be doing when I irrigate is I'm going to be going from top to bottom on one side, and I'm holding the irrigation tip 10 to 15 centimeters away. So top to bottom and back on one side, top to bottom and back on the other side, and then just down the middle of the wound. And I would repeat this as many times as needed until any exudate or debris had been removed from the wound and the normal saline was kind of draining more clear. So that's great for the time being. I'm finished with this, so I can just throw it in the garbage. Now I'm going to be cleaning the peri wound area. So how I like to do this is I'll just take a couple 2x2s, or one 2x2 at a time, sorry, and then I just put it, grab my forceps, dip it in the normal saline, and then I'll start closest to the edge of the wound in the peri wound space and just do a swish at the end. Okay, just repeat this. I'm going to do it probably about 3 times on each side of the wound. Dab it in the normal saline, and again I'm making sure that no normal saline drips onto my sterile field as I'm doing this. How are you doing, Mr. Smith?
Good.
Great. Okay, so just again, just on the outside. Okay, dip that in the saline. Okay. And we'll do this one more time on each side. Another thing to also note is that if any kind of liquid had been stuck in the wound, in the base of the wound, I could always ask the client to manipulate his position if he was able to, or else I would just gently take some 2x2s or something like that and just dab up the liquid in the wound space. Okay, now I will just gently dry each side of the peri wound area. Okay, and I can probably manage to do that, just dabbing dry, one on each side. Okay, and now I am ready for my skin prep. So I'll just grab that. And I'm just gonna skin prep. I've got 2 skin preps, so I'll do one for each side. Okay, and at this time I would complete the assessment, any components of the assessment that I hadn't already done, because it is a clean wound. So one of the things is I would measure the depth with the Q-tip, just make a crack, and I would also palpate to make sure there was no tunneling or undermining. I'd inspect the peri wound area, I'd pay attention to any odor, and I'm also taking a look at the tissue in the wound bed. The edges are well approximated. It looks like it's 100% red, healthy granulation tissue, so that's good. Now I'm ready to pack the wound. So I'm going to be soaking this packing in the normal saline as it was ordered. Okay, so there's my ABD pad and my 4x4s, and before I do this, because my hands will be pretty tied up, I just kind of want to take an inventory of everything. Okay. Okay, Mr. Smith, so I'm just about getting ready to pack the wound.
Okay.
Because this is a frayed edge, I'm just going to tuck this in so that there's no kind of exposed part of the packing. And I'm going to use these forceps, so I'm going to just gently place some of the packing in. Ouch. And with these mannequins, as I know from multiple times of practicing, it's a little bit awkward, but what you're going for when you're packing is to cover all of the granulation tissue. You don't really want too much of the packing touching the peri-wound skin area, but you also definitely do not want to leave any of the granulation tissue exposed. This video may not and probably will not be too perfect, but just worth noting. Another thing, as I'm kind of compressing the packing, is I don't want to be too kind of intense with my pressure, but I also want to make sure to pack the whole wound. Overpacking results in potential loss of blood flow to the granulation tissue and can lead to further damage or just a lack of blood flow, slowed, delayed healing, and underpacking can lead to something like another abscess forming or rolling wound edges. Okay, oh yes, that's a fun time. Okay, so that's a little bit awkward, but I don't think I broke sterility there because this area is clean. Okay, so that's packed. Now I've got my lovely tail. Okay, I'm just gonna take my scissors and do a cut. Oh yeah. Okay, so these are great scissors. So I've touched his skin, but I'm just gonna move to a no touch anyways because I'm practically done here. So now I'm gonna grab my steri strip and just secure this packing tail. And okay, now I will grab my two 4x4s. Okay, and a lot of this education that I'm kind of talking through in the video, I would, if the patient was interested, be teaching him or her, but of course I would be doing this in a different type of, I'd be using different simplified words and all of that. Okay, so now that's all done. Okay, I'll secure that with tape just as per the orders. I like to go all the way across like this. Okay, another thing that I also like to do, because I'm a weirdo, is I would ask the patient if he did want to see the dressing that was removed or the wound. Just for curiosity's sake. Okay, Mr. Smith, so that's all finished. Can I bring you anything before I tidy up and just go make note of all of this?
Nope.
Okay, that's great. So at this point in time, I would clean up the room. I would leave the room with safety procedures, call bell, right bed height, all of that. And then I would chart my findings. And that's everything. Woo. Oh, also, if you haven't stopped yet, I would I would write the time, the date, my initials, and just one on the dressing, one for the amount of packing I put in. Okay, thanks.